Let's talk about explaining your CRMA results to your patient. It's their results, right? It's their study. So how do you explain it to a patient? How do you explain the results of a CRMA to your patient? Well, first of all, I'm going to tell you that it's no different than explaining the results of an MRI to your patient. A patient has a disc herniation. Okay, you explain what the disc herniation is and what the ramifications of the disc herniation is. It's no different with excessive motion testing. So I'm going to give you an example of speaking to a patient about their excessive motion test. Now, to set the patient up, or to set the scenario up, you would have already informed, I would have already informed, hey, one of the things we're going to do is we're going to send out for an excessive motion study. The excessive motion study is going to pick up damage to your spinal ligaments. So your ligaments are what hold your bones together. As a matter of fact, anyone that you know that has any form of chronic pain, chronic low back pain, chronic neck pain, or chronic headaches, usually has a ligament injury that's gone undiagnosed, and the doctors that are working with it have no clue about it, and that's why they can't get help. Now, we're going to make sure that doesn't happen with you, because we're going to do a proper evaluation of your injuries, and we're really good in our clinic at doing that. All right, so I'm already going to set them up. I'm going to have materials ready for them that they're going to read about these injuries, and I've already set that up. But now the results come back. So I've already said, look, this is the most significant injury that you can have. I'm also going to tell them, very few doctors understand how to work this up, right? Not in my area, so I'm going to say that, because a lot of doctors do not know how to work these injuries up. So when you understand how to work them up, you should promote it. So now I'm with the patient. Let's say the patient's name is Jerry, and the test results come back. My front desk is already going to be saying, hey, Jerry, your test results came back. Dr. Cronk will be going over with them today. Patient's like excited, like, okay, great. What is this? Remember, an excessive motion test is a test that shows how damaged the ligaments are. So Jerry comes in. Jerry, I got your test results back today. You have 2 levels of pretty significant ligament damage in the upper cervical spine, C2, C3, C3, C4. I just reach over, show them exactly where that is. Okay, the ligament damage that's up here is significant. Now, doctors, I'm not going to tell them that they're going to be surgical, even though they are surgical. I'm not going to tell them, hey, this is surgical and you may need to get a surgical consult. I'm not going to say it that way, right? I'm not going to put fear into the patient. And the reason why is because I'm really good at stabilizing these conditions. So, Jerry, you got significant ligament damage up in the upper cervical spine. Now, what that means is you're a patient that's at high risk for what are called long-term residual complaints. Those are things that don't fully go away. Right? So I really need you on board. We're good at stabilizing this type of a condition. I've given you materials to read about it. We're good at it. But here's the thing. What I need you to do is, if I say I need 3 times a week, I need 3 times a week. So I need you to be, you have to be the patient that can't miss. And if you do miss, make it up. Right? The other thing is, if I give you something to do and it seems like it irritates this, don't try to tough it out. Let me know right away, because the gradient might be a little bit too, I skipped the gradient with you. In other words, I put you into something that you can't quite tolerate yet. So I don't want you to not tell me. If something's causing you problems, if I give you a home exercise, if I have you do some things in the office here, besides the adjusting, if any of that bothers you, just let me know right away. Okay? Now, the other thing I need you to know about ligament injuries is a ligament injury is permanent. It's a permanent condition, and it causes an instability. Anything that's unstable is prone to erratic or unpredictable behavior. If your neighbor were unstable, they do erratic and unpredictable things. No different here. Now, let me tell you what that means, though. What that means is in treatment, I can start to treat you and stabilize this, and you think, oh my God, a month, 2 months, 3 months into it, I feel like I'm right back, to normal. And then you fall asleep watching Monday Night Football, and your head's in a funny position, your neck's in a funny position, you wake up and think, oh my God, I'm right back to where I started. It feels exactly like it did on day 1. That's normal. That's not abnormal. So if you hit that, I want you to know that can occur. All you do is come back in for an adjustment or 2, and I'll stabilize it. And you'll see it's right back to where we had it. So don't go wondering, oh, is this care working, or it isn't working. Just come right back in and let me know. That's common. It doesn't happen to everybody, but if it happens, I'm letting you know it can happen. All right, the other thing is, most patients long term, we'll do better once we have this stabilized, and we don't know how long it's going to take you to stabilize. Each person's different. But once it is stabilized, there's a thing called supportive care. That's every quarter, twice a year, 4 times a year, where a patient comes in just to maintain the stability of what we did under treatment. And I'm not going to make any recommendations at this point. We need to actually let's see how you do under care. But I want you to know that I will be recommending that at the end, because most patients do very well with it. We don't have to talk about it. We don't have to talk about the insurance or what the costs are or anything else. But just know that I'll have that conversation with you at the end. The other thing I want you to know is that when you have this condition, we now have a profile of it, right? So if you've ever injured yourself ever again, I have an exact profile of your spine and where it's at this point. So we're going to get you started under care. What I need you to do is be very consistent with the care, and I need you to communicate if anything comes up. Does that make sense to you? Yes. Good. The patient says yes. All right. That's how I explain the results of a spinal CRMA results with a patient. That's just an example. And that's the way everyone should be explaining it. You have to explain to the patient, what is this condition? What does it mean? What is the thing that they may hit down the road? Because the more you understand what this is and what the patient can experience, and the better you communicate it. If the patient 6 months from now, 4 months from now, does something and it's like, oh my God, my neck is right back, they're just going to look and say, oh, Dr. Cronk told me about that. Wow, he really understands these injuries. They're not going to be like, oh man, this isn't working. This Dr. Cronk's had me come for 3 months, done all this treatment, and basically this isn't even working. There's a big difference in both scenarios, and I hope you see the difference, and I hope you're the one that chooses to explain the results properly to your patients.